Screening and counseling, alcohol and depression. Did you know that studies show up to 40% of residents in long-term care can experience significant depressive symptoms? Many of our patients face silent struggles. This module provides our toolkit for proactive, compassionate care, the annual screenings for depression and alcohol misuse. We use 3 specific Medicare G codes for these services. G0444 is the annual depression screening. G0442 is the annual alcohol misuse screening. And if a patient screens positive for alcohol misuse, G0443 is the code we use for providing up to 4 sessions of brief, face-to-face counseling per year.
These conversations require trust. Always ensure a private setting. For tools, use the PHQ-9 for depression and the AUDITC for alcohol. When asking for consent, normalize the process. Try saying, "To provide the best holistic care, I ask all my patients these questions annually. Would it be okay to ask a few questions about your mood and alcohol use?" If they decline, respect their choice. You can say, "I understand. Please know this is always available if you change your mind." If a patient screens positive on the audit C, you can provide 15 minutes of brief counseling under G0443. An easy, memorable framework is FLO. First, give feedback. Your score is in a range that could pose a risk to your health. Then, listen. Tell me a bit about your thoughts on that. Finally, explore options. Would you be open to talking about some strategies for cutting back? This simple structure can guide a productive, patient-centered conversation.
Now for a critical billing rule. These G codes can and should be billed on the same day as another EM visit. To ensure proper payment and signal that the screening was a distinct service from your problem-based visit, append a modifier 25 to the EM code, like a 99309-25. This is the correct way to bill for both services on the same day. Your documentation is simple but essential. It proves the service was performed and tracks patient progress. A single, clear line for each service is all you need. Be sure to include the tool used, the score, and a brief plan or interpretation.
To recap, these are annual screenings. Create a safe space for the conversation. Use the FLO framework for brief counseling. And when billing with an EM visit, add a modifier 25 to the EM code. By integrating these simple but powerful screenings into your workflow, you provide truly holistic care and can make a profound difference in your patient's quality of life.